For a coronavirus vaccine, the drug maker Pfizer believes the vaccine could be ready for emergency use this fall. The Wall Street Journal reports Pfizer and its partners could be testing the vaccine in the U.S. as early as next week. Until now, researchers have generally said it would be next year before a vaccine is available. Now the report says that timeline could be moved up for at least some patients to September. Well, this pandemic has taken a harsh toll on Black Americans. As of yesterday, African Americans accounted for more than 58% of coronavirus deaths in Louisiana. A new initiative called the Skin You're In, Coronavirus in Black America, hopes to address the disproportionate impact. Dr. Thomas LaVeist is a co-chair on the governor's Health Equity Task Force and Dean of Public Health at Tulane, and joins us now via FaceTime. Good morning, Doctor. How you doing?
I'm doing great. Thanks for having me on your show.
Oh, absolutely. So before we get into the Skin You're In initiative, let's talk a little bit about the task force that you're on and kind of what you all are hoping to tackle with that task force.
Yeah, but the governor, I think, was farsighted in seeing the importance of thinking about not only what's happening during the pandemic, but how we come out of the pandemic. And he appointed the task force to look into why do we have such disproportionate deaths among African Americans. So that's one of the goals of the task force. But ultimately, the goal of the task force is to help the state of Louisiana to improve the overall health of the state and to ensure that as we come out of the pandemic, we don't have racial disparities in health.
Absolutely. Let's talk about that right now, because this initiative, this Skin You're In, is something that's trying to kind of dispel any of those myths out there that people may have seen on social media or whatnot. Let's talk about the goals of that initiative.
Yeah, but there's a lot of inaccurate information that's been targeting African Americans. You know, early on, there was a myth that African Americans were somehow immune to the virus, which never made any sense to me, but many people believe that. We established this informational campaign to provide authoritative information specifically targeting African Americans, but of course we'll be in the media, so we'll be providing information to any population, but specifically African Americans, to try to dispel those myths and provide them with accurate information on how best to survive through this pandemic.
Well, certainly there's some big questions out there, and I know not all of them can be answered right now, but when we look at those numbers and we see that disproportionate number of African Americans who are affected, it really begs the question. It's not necessarily something that targets African Americans directly. Do you think it's more of some other contributing factors that are leading to that?
Right. So clearly we need more data to be able to really say exactly what's happening. But at this point, it seems to me that there's a combination of factors here. One is that the chronic conditions such as hypertension, diabetes, asthma, COPD, that place people at increased risk of dying if they are infected. African Americans have higher rates of all of those conditions. And that is one of the factors. I don't think it's the entire answer. We also have an issue with access to health care. You know, we have an employer-based health insurance system here in the United States. And as a result, people that don't have an employer that provides health insurance are uninsured, which meaning access to health care is more difficult for them. African Americans are more likely to have difficulty with access to health care as well. So they also work in occupations that place them, they work in occupations disproportionately that place them at increased risk of being exposed to the virus.
I mean, all of that really makes a lot of sense. And like you said, you know, as the epidemiology increases in the months ahead, I'm sure we'll get a better picture of what's happening. But what sort of things have you seen recently that have at least attempted to expand the access to the African-American population here, including testing? I know there's a site in Marrero that just recently opened.
Right. Well, I'd say two things. One is that in Louisiana, most of the states that surround us have not expanded Medicaid as a part of the Affordable Care Act. Louisiana has done that now with Governor Edwards, and I think that's one thing that's been really important. Also, the city of New Orleans is now using mobile testing. So by having vans go out into different communities and test people, that's reaching people who could not be reached with the drive-up testing sites that they previously had. Both, I think, are really important improvements.
So at the end of the day, it's important for the public to know that some of these myths just aren't true. How can they find out more information, especially about the Skin You're In initiative?
Well, hopefully people will come to the website, follow us on social media, and come back often. These social media sites and the website will be updated regularly. We'll have a newsletter, we'll have a podcast, and people will go to the site. The website is tsyi.org, which are the initials, TSYI, the skin you're in.org.
You've made it easy right there, Dr. LaVeist. We appreciate you very much for joining us this morning. I'm sure we'll learn a lot more in the weeks ahead. Thank you.
Thank you for having me.
Well, time now.